My name is Prab Takhar. I was the director in the Molecular Imaging and Therapy Research Unit at the SAHMRI facility, which is a CRO, which was doing a large amount of work in various areas of research. So currently, I am the head of a cyclone facility in Europe. So I run a very similar facility that I did in Adelaide. And so we've been developing a lot of short-lived isotopes, very similar to what we were doing in Adelaide, and trying to make sure that we can ship to local scanners. So when SAHMRI was built, there was a decision to make a cyclotron facility which would make radiopharmaceuticals. Radiopharmaceuticals have a very short half-life, so it's very important to make sure you get them to the right facility at the right time and to ensure that you've got end-to-end. Now, I'm very used to the high standards that were developed from the International Atomic Agency and groups like this, where, I want to make sure there's a correct handshake from where you're supplying to the end point, which is normally the hospital or scanner. So the key thing was for when you send a pharmaceutical, which is very short-lived, you need to ensure that there is kind of security all the way through, that the delivery system that you're using does not stop along the way, you don't have a snack, all those kind of things as well. So one of the important aspects that we did was we did a lot of vendor, what's called examinations. And one of the companies that came up was DGA. And so when we started discussing this with Brad, he kind of came to us with a whole program of how we could achieve this in the high standards that we required. When you're trying to build a facility, you need to keep reputation in front of you at all times. So the important thing was that I wanted to make sure that if there was an interruption in supply, or if there was something that went incorrect, that we got notified quickly and immediately. And also that the person that we were using also knows the regulations in Australia, not just nationally, but also internationally. And so we were very impressed, actually, by the amount of information and the processes, and also DGA. And so at that point, we realized that this would make a great partnership. At that point, we were getting a TGA license. And the important aspect for the TGA was that we continued to hold a process which was end to end. So apart from just manufacturing from a particle accelerator, we had to make sure that it got to the scanner and to the patients on time and within a certain, what's called, time frame, and what's called not interrupted in any way. And so from our point of view, when DGA kind of came up with the process, we realized that we could ensure that process was included in our federal license and our options that we gave. So we developed it for local, and then we developed it for national. So DGA kind of held our hands throughout the whole process. So locally, we started delivering to the hospitals, then private clinics, to make sure they got delivered on time. The logistics was all handled by DGA. So from our point of view, we didn't need to think. And when you're focusing at 4:00 in the morning, it's really good that you don't have to think, that you know what time things are being picked up, what time they're going to be delivered, etc. And those timings will work very well with ourselves and DGA. Then what happened was when we went nationally, all the centers that we needed to deliver to as backup suppliers, as well as clinical trials, we ended up using DGA all the way through. So an example would be if you were doing a clinical trial, we had to ensure that we had pick up in the afternoon, because it would take us almost the whole day to manufacture this compound. We would then ship it overnight, and then it would get delivered to the what's called center in the morning. Often that didn't always work well because it's clinical trials, but we wanted to ensure that if something did fail or something did go wrong, we could get it on the next plane, even if that was at 4:00 in the morning. And DGA was always able to ensure that on the other side, that the clinics that we were working in the national program with were never affected. So I think those things are very important when you're looking at a holistic kind of approach. When there was a shortage during Corona, an example would be that we were trying to ship interstate, we were trying to ensure that there was national supply, and that was very difficult. And DGA kind of tried everything with us to ensure that we could continue supply. In the end, that meant there was a federal act change, but at the time we were trying everything to ensure that continuity of supply was important. So we've kind of gone through a lot with DGA when I was over in Australia. And I think that's an important aspect, that you build a relationship with a company that wants to ensure your success as well. So when I was hired as the director of the Molecular Imaging and Therapy Research Unit at SAHMRI, it was always planned that we would start locally and then go national with our program of radiopharmaceutical supply. And the whole hope was that we would probably do a few scanners in our own state and backup supply for others. In the end, I think we ended up delivering to almost every state in Australia except for Canberra, simply because there was no scanner at the time. But apart from that, we delivered to, I remember when we were shipping to Hobart, because there was a shortage supply. We did a lot of supplying to Perth, especially new compounds that were being developed and being pushed by the clinics over there. And then we were also shipping a lot to Darwin as they're building their cyclotron facility. So DGA helped achieve that vision by ensuring that what we were trying to supply locally was in a robust way, that we were a new company setting up. We had to make sure that our suppliers and our scanners and all the different groups that we were bringing in were all happy with the process. And so we had to make sure that the group that we selected was professional, had uniforms, had kind of a process where end to end was always seen, that any troubleshooting or anything that went incorrect was always kind of documented and was notified almost immediately. And so that's why we selected DGA in the end for us, because they ticked all those boxes. So without DGA, I don't think we would have been able to achieve what we had achieved to that point. I don't think we would have been able to supply the regular compounds that we delivered with a very short half-life. So we're talking about 14 hours to the ones that we took about 3 days for having shelf lives. But those things were only achievable because we knew that we could trust the process all the way through. So from our manufacturing, that was one stage, but delivery is a really important aspect when it comes to radiopharmaceuticals. And you must remember that those things are an aspect which the TGA is now getting a lot more involvement. And so for us, making sure that clinical compounds, especially when we're doing clinical trials which are national, had to ensure that I don't think we would have been able to achieve that. So without DGA, we wouldn't have been able to achieve our growth plans. So we had planned on growing nationally. And so that was great when it came to normal radiopharmaceuticals with a shelf life of 12 hours. When it came to the more complicated compounds, which had shelf lives of 3 days, where we had to ensure that it was injected in day 1, ensure that we had continuous scanning on day 2 and 3, we had to make sure that those compounds were delivered in the right manner and at the right time. And so those things we wouldn't have been able to achieve without DGA. And I think those are what you're going to see happening in the next few years when those results start coming out in papers, that big national companies are purchasing those compounds from all the groups that we work with. Some of the roadblocks that we faced were mostly cleared by a lot of the paperwork that DGA already had. So when it came to national processes, all those things that you would normally have to kind of deal with, road deliveries, plane deliveries, all those things were covered by DGA. The other problem that we often faced was that the cost was always seen as an issue. For us, it never was, because cost isn't important when it comes to something where it's short-lived, that you have to have control, that you have to make sure that deliveries occur and your reputation is important. So when your reputation is important, you must remember that those things come first. An accident that occurs with a company who doesn't know what they're doing is a lot more, bad, negative news articles, which you don't want, especially when you're a startup, when you're a national program, or when you're trying to ensure that there's going to be high quality of your results when you've got those drugs to those patients. So a lot of the important things to remember is when you're delivering these kind of drugs is that the trust is on the site. So consequence of an error or something happening, not just because things happen. I mean, that's the nature of processes. So some of the consequences that can happen is reputation loss. So when you're a company which is just growing, especially when we're SAHMRI, and I had been based there for almost 7 years before I left, And so the first year was the setup, the other 6 years working with DG Air to ensure that we had full supply. We never had an incident all the way through. But if I know that if we did have an incident, I would have been having the confidence to ensure that, I didn't need to worry, that I would have got all the reports that I needed, that I knew that my drug and the people and the personnel was well protected all the way through, because DG Air has all the well-trained staff that is needed to ensure there was end to end. So from our point of view, consequence would have lost our reputation, would have lost our revenue, would have cost all of our contracts, maybe long term. We had contracts with the state government as well as private vendors. So when you're looking at those, you're talking several $1 million a year that you could have lost just through reputation loss. So those things, when you're a small business, is very important to ensure. And a lot of these radiopharmaceutical facilities are small to medium enterprises. So it's very important that we hold on to our aspects of our reputation, our processes, as well as making sure that we're not endangering anyone long term. So if something had gone wrong, the impact on me personally and professionally would have been kind of quite severe, in the sense of you would have been that person that people would have known linked to that incident. And so those things are often things that we carry with our careers for the rest of our working lives. So to make sure that those things are kind of removed from the process, you need to trust in a group that will ensure that does not occur. And DG Air was that for us. So most of the things that I lost sleep over was related to particle accelerators not working, issues when it came to power outages in the state, things like this, which I have to say that DG Air was always there for us. So an example would be when the power supply went down for the whole state, we lost a lot of our activity. We had to restart the whole process again. But the issue was that we were supplying interstate, and we had to turn to DG Air, who picked up our isotopes, took it to the airport, and the airport still didn't have power. It was kind of interesting that we were able to go live, but we weren't able to supply. So those are the things that we kind of realized that, our partnership works well, but you can't have every contingency covered. So you can only cover what you can cover. So our biggest problem was that we started quite early in the morning when it came to manufacturing, and often things went wrong. And so you had to ensure that you were able to pick up a phone and contact the different people, especially when it comes to couriers. So we would have a list given to us from top to bottom of who we call first, who we needed to call second, how we could change when it came to what's called interstate deliveries. So all those things were very well controlled. We could send emails we're talking 4 o'clock in the morning, and we knew they would be answered. So when you had those kind of aspects covered, you knew that you could sleep and rest easier about those things occurring. Whereas the things you can't control, where, power outages, electrical equipment failure, all those kind of things that generally goes wrong when you're manufacturing a very specific compound. We never worried about our DG Air, what's called contract, or our processes that they held. So with DG Air, the thing that made them stand out above everyone else was because they already were prepared. They knew things before we did. They ensured that they held our hand through the whole process. They made sure that their connections across Australia were the most important things for us in our growth of our facility. So as we grew, they grew with us and made sure that we continue to have that same quality locally as we did nationally. It's been great working with Brad and stuff. So from my point of view, it's been a great way to ensure that we've grown together. And so every time I've had an issue, I've just literally picked up the phone and Brad sorted it. So I don't want to really say that, because all of a sudden Brad's been the one who's going to get all the phone calls. There was nothing that was called DGA couldn't solve. It was never an impossible hurdle. They just kind of said, okay, we'll try to fix it. So it was kind of a fun process to do. There was always you'd be panicking over, can we deliver a drug to a state which doesn't have a delivery system, that we need to make sure that the courier can get to a place which is in the middle of whoop whoop, as everyone always used to say to me. And I was like going, well, who do we turn to? And we just turned directly to DGA. So they'd always solve it. So that was always a good thing for us. Because I've worked such a long time with Brad and his team, it's like they became part of the group. I mean, we didn't even see the difference. That was a great thing. It was part of the family. And so the trust levels, I mean, we once got supply from this interstate, and it went into the state and it just went completely wrong. And we got charged, I don't know, triple the cost of delivery. And we didn't achieve any of the things that we were supposed to. So the reputation by another supplier supplying was terrible on ourselves. And had we known that, it was just, no, it was just something we just don't want to do again. So it was kind of important that we kind of ensure that it's the difference between, working with someone professional or working with someone who has no idea what they're doing and just, a freight forwarder. So there's a chasm difference between the two. I mean, like even nationally, do you remember when we were doing the interstate stuff? So, within Adelaide, we had a rate. So some of the machines broke. And so what happened was that one of the companies, Jones and Partners, turned around and said that they needed some of their materials, which is nothing related to what we do, but they were radioactive and wanted to move them around. But they didn't want to sign a new contract. So we had to use our contract to ensure that DGA could do all that work. Those kind of things that you just don't hear, those small stories. But those are successful stories which, are just kind of put to the wayside because you just know that, they can solve it. It was a lot of small things that you helped us along the way and for the state as well. I just don't think they appreciate how much you've done for us. And the way that it made our reputation look so great and polished and everything else was because of that reasoning. If we didn't have DGA, I don't know who we would have turned to actually. So overall, when it comes to radiopharmaceuticals, I would always turn to DGA simply because they know what they're doing. They're very professional in their process. You have the confidence all the way through from end to end that you know that your processes, your activity, that all the hard work that you've done previously, once you hand it over, you know that it's going to get there in time and you know that it's going to get there in the right state as well. So those things are very important. And so if it was me selecting a new kind of courier system, I'd want all those things, and DGA encompasses those.